10 to 20% of children will harbour this completely asymptomatically in the back of their throat. Nothing much seems to be happening there at all, and it will be there for a while, and then it won't be there, and some other child will have it for a while, and then it will move on. But what we know is that repeated, untreated infections in the throat, and more we're thinking also infections in the skin, particularly early in life, seem to, if you like, confuse the immune system. And the exact way that they confuse the immune system has been a topic of really intense investigation for decades, but we're not completely sure. But it does seem to be repeated early life infections that aren't treated. We see almost no rheumatic fever in some places, and so we don't see a lot of rheumatic fever in most of the USA. We don't see a lot of rheumatic fever in most of Australia. We do see a lot of rheumatic fever in low and low middle income countries, but also amongst groups in some wealthier countries like Australia and New Zealand, where life isn't so great in terms of social determinants of health, socioeconomics, and particularly when you think of Pacific Islanders living in New Zealand and Australia, the Maori Indigenous group in New Zealand, and Aboriginal and Torres Strait Islanders in Australia, where the rate of rheumatic fever, and that's this post-infectious problem, an autoimmune problem, is as high as it's ever been recorded anywhere in the world. The interesting thing, Mark, is that you might imagine that means perhaps there's some really important genetic story there, and that some people are vulnerable, and that some people just aren't vulnerable. And in fact, we went digging into our hospital's records from the 1930s, and it's very clear that in a place like Melbourne, where in 1930 there were very few Aboriginal and Torres Strait Islanders, very few Pacific Islanders. It would have looked, I think, in many respects like New York in 1930. And in terms of the population, there was a lot of rheumatic fever and a lot of rheumatic heart disease. There was also a lot of poverty and a lot of early life untreated infection. And so I think that's the story. This is, one of those diseases that really follows rheumatic fever and rheumatic heart disease are diseases that really follow a social gradient. And during times when life was really hard, and in places where life is really hard, you see rheumatic fever and rheumatic heart disease.
Really brilliant answer. Before I get to the heart of this, though, a quick aside on scarlet fever. Who gets it? What is it? Is it worrisome?
Yeah, it's a great question. So scarlet fever in 2025 is really having a sore throat, so red sore throat, maybe a fever and other signs of having a strep throat, but also having a skin rash, and that's usually described as sandpapery, covering most of the body except with an odd kind of sparing or whiteness around your mouth, but with very red cheeks usually, and sometimes also kind of sparing of the folds in your arms and legs. It's a sign of the effect of a toxin from the bacteria. So when the bacteria is there, it produces lots of little chemicals, and some of them seem to land and they tickle T cells in your immune system, and some of the things that your T cells make your skin red. And so that's what we call scarlet fever in 2025, and we think that the strains that do that might be more dangerous than other strains. But we're not completely sure about that. Certainly, in some countries, scarlet fever cases are a focus for early treatment and school exclusion, and the idea for at least 24 hours. And the idea behind that isn't so much for the person with scarlet fever, but it's because of concern that strain might really hurt the next person in line. In the past, though, scarlet fever was the term. So this is in the 1800s. Scarlet fever was a term that was used to describe everything we're talking about today.